Figures as at noon today. In the past 24 hours, 83 people have been diagnosed as new cases of COVID-19 in Australia. This brings the number of people who've been diagnosed with COVID-19 in our country to 26,207. The global figure for the number of reported COVID-19 infections sits at 26,517,985. Sadly, another 11 deaths have been reported in the past 24 hours, all in Victoria, and this brings the number of people who've died from COVID-19 in Australia to 748. The global figure of the number of reported deaths from COVID-19 is 873,131. My thoughts are with all those who have lost their loved ones to COVID-19. Over the past 24 hours, there has been one new reported case in South Australia in a traveller from interstate, one new reported case in Queensland, and that is currently under investigation, 5 new reported cases in New South Wales. One of those is overseas acquired and that person is in hotel quarantine. The 4 other cases are all locally acquired and they're all contacts of confirmed cases. And there have been 76 new reported cases in Victoria. In the past week, we've seen 663 new cases of COVID-19 in Australia. This figure continues to fall and compares to the previous week when we saw 951 new cases, the week before with 1,600 new cases, 2,354 new cases the week before that, and 3,493 cases the week before that. This continuing and welcome fall in new numbers of cases is the result of the restrictions in place over the past month in Melbourne and across Victoria, and the personal responsibilities that the vast majority of people in Australia are taking to prevent the spread of COVID-19 and to protect the lives of all people in our country. I acknowledge the sacrifices that have been made and continue to be made by people across Australia, and especially by the people of Melbourne and Victoria. Nationwide, there are now 327 people with COVID-19 reported to be in public and private hospitals, which is 30 fewer people than yesterday. Last Saturday, there were 510 people in hospital with COVID-19, so we've seen a very substantial reduction in the number of people hospitalised with COVID-19 over the past week. Among those in hospital, there are 27 people in intensive care units and 19 people on ventilators. Over 6.59 million COVID-19 tests have been carried out across Australia since the start of the pandemic, with over 63,000 tests carried out yesterday. It remains very important that we all get tested if we develop symptoms of fever or cold or flu, no matter where we are in the country. Our response to the pandemic of testing and tracing and isolation continues to work and work well. We recognise that it is essential that every new case of COVID-19 is being followed up every single day so that we can prevent further transmission of this virus. The work of the contact tracers, especially in New South Wales and Queensland, continues to be very strong. The automation of the contact tracing system in Victoria is very welcome, as is the continuing support being provided by members of the Australian Defence Forces. Just 2 months ago, on July the 5th, with the first wave of COVID-19 well behind us in this country and the signs of the second wave just beginning in Victoria, we reported that 8,449 people had been diagnosed with COVID-19 in Australia, with 104 deaths. In just 2 months, we've seen an additional 17,758 people diagnosed with COVID-19, and tragically an additional 644 people who have lost their lives. These stark figures show us the serious impact of the second wave of COVID-19 in Victoria. Tomorrow is Father's Day. Like many of our special days over the past 8 months, Father's Day is going to be different for many people in Australia this year. Many families in Australia are separated due to the Stage 4 restrictions in Melbourne and the Stage 3 restrictions across Victoria. Many families are separated by the border closures between some of our states and territories. And many families are separated by the international border restrictions with loved ones in other parts of the world. Tomorrow, if you're lucky enough to still have your father or your grandfathers or perhaps even your great-grandfathers in your life, please reach out to them and let them know how special they are to you. If you can't see them in person, you can still reach out, of course, by telephone or video chat and come together virtually on this special day. Please do not breach any restrictions in your local area to see your father or put his health and well-being at risk, especially if you're living in an area of community transmission or under restrictions. And for those of you who no longer have your father in your lives, tomorrow will be a sad day, but we can still take some time to reflect on our dads and the love and the wisdom that they shared with us, and to think about what he would have had to say about this pandemic and the challenges that we're all living through at this time. Thank you very much, and I'm happy to take any questions. I think I have Jade on the phone.
Yes, thank you. Could you just explain how the AHPPC came up with the definition or proposed definition of a hotspot that was put to National Cabinet yesterday?
Thank you. So the definition was proposed by the Commonwealth Acting Chief Medical Officer, Professor Paul Kelly. It's based on our analysis of locally acquired cases in Australia over recent months, and that paper was presented to National Cabinet, provides quantitative and qualitative metrics to determine COVID-19 hotspots for the purpose of the provision of Commonwealth support. And just a reminder, decisions are going to be made based on the threshold of a metropolitan area having had over a 3-day average, 10 locally acquired cases per day or more, which equates to over 30 cases in 3 days, or in regional or rural areas, a 3-day rolling average of 3 locally acquired cases per day, which of course equates to 9 cases or more over 3 days. Thanks, Jade. Do you have any further questions?
Yes, just given, I suppose, the differences in each state, how difficult do you think that it might be to reach agreement from all the states and territories, at least excluding WA, on that definition of a hotspot?
Well, clearly each of these states and territories is looking at their own local epidemiology, but this definition is the definition that's been adopted by the Commonwealth, and this will be the definition we'll be using in determining the Commonwealth support for responses across the country. Please.
What are your thoughts on the anti-lockdown protests that are happening in Melbourne?
So the question is thoughts about the anti-lockdown protests that are occurring in Melbourne at the moment. I haven't seen any of the reports on the protests in Melbourne. I hope that people are maintaining their physical distancing, that people are wearing appropriate face coverings to protect themselves and protect others. Clearly, these restrictions are in breach of the regulations which are in Victoria at the moment. While there may be a few hundred people who are protesting, there are millions of people who are adhering by the restrictions and doing all they can to bring COVID-19 under control in that state. Thank you, everybody, and thank you to our interpreters. Thank you.